Hello and welcome. Today, we're delving into the complexities of a rare but significant heart condition, Desmin-Related cardiomyopathy. This isn't your everyday heart disease, so buckle up as we unravel its intricate details, from its origins to potential future treatments. We'll explore what causes it, how it affects the heart, and what can be done to manage this condition. Desmin-Related cardiomyopathy, often abbreviated as DRC, stems from mutations in the Desmin gene DES. This gene is responsible for producing desmin, a protein vital for maintaining the structural integrity of muscle cells, including those in the heart. These mutations, often inherited but sometimes arising spontaneously, lead to the production of abnormal desmin protein. Think of it as a blueprint with a typo, causing the construction crew to build something slightly off. These errors then lead to a domino effect that impacts the heart. So, how does a faulty protein mess up the heart? The abnormal desmin aggregates, or clumps inside the heart muscle cells, called cardiomyocytes. These clumps disrupt the normal organization of the myofibrils, which are the contractile units of the heart. Imagine trying to run a machine when all the gears are gummed up with sludge. As the desmin accumulates, the heart muscle weakens and stiffens. This can lead to dilated cardiomyopathy, where the heart chambers enlarge, or restrictive cardiomyopathy, where the heart struggles to fill with blood. In some cases, it can also cause arrhythmias, irregular heartbeats, due to disruption of the heart's electrical system. DRC is considered a rare disease. Due to its genetic nature, the exact prevalence is difficult to determine, and it's likely underdiagnosed. It can affect people of all ages, from young children to older adults. However, it often presents in adulthood. Because it's a genetic condition, it tends to run in families, meaning that individuals with a family history of heart disease or muscle disorders may be at a higher risk. The signs and symptoms of DRC can vary greatly depending on the severity of the condition and which part of the heart is most affected. Common symptoms include shortness of breath, especially during exertion, fatigue and weakness, swelling in the ankles, feet, or abdomen, palpitations or irregular heartbeats, chest pain or discomfort, and dizziness or lightheadedness. It's worth noting that some individuals may experience few or no symptoms in the early stages, making early detection a challenge. Diagnosing DRC can be complex and often involves a combination of tests. A thorough medical history and physical examination are the first steps. An electrocardiogram, or ECG, can help identify any irregular heart rhythms. An echocardiogram uses sound waves to create an image of the heart, revealing any structural abnormalities or problems with heart function. Genetic testing is crucial to confirm the presence of a desmin gene mutation. A cardiac MRI may be used to visualize the heart muscle and detect the characteristic desmin deposits. In some cases, a heart biopsy, where a small sample of heart tissue is examined under a microscope, may be necessary. While there aren't strict classifications or types of DRC in the traditional sense, it's often categorized based on the specific type of cardiomyopathy it causes. As mentioned earlier, this can include dilated cardiomyopathy, restrictive cardiomyopathy, or arrhythmogenic cardiomyopathy. The phenotypic expression, or how the disease manifests, can also vary widely, even within the same family, further complicating categorization. Currently, there is no cure for DRC. Treatment focuses on managing the symptoms and preventing complications. Medications may be prescribed to improve heart function, control heart rhythm, and reduce fluid buildup. Lifestyle modifications, such as a low-sodium diet and regular exercise, are also important. In severe cases, implantable devices like pacemakers or defibrillators may be necessary to regulate heart rhythm or prevent sudden cardiac arrest. For end-stage heart failure, a heart transplant may be considered as a last resort. Unfortunately, there are no specific preventative measures for DRC, as it is primarily a genetic condition. However, genetic counseling and testing can be valuable for individuals with a family history of the disease. Early diagnosis and management of symptoms can help slow the progression of the disease and improve the quality of life for those affected. The prognosis for individuals with DRC varies considerably depending on the severity of the disease and how effectively it is managed. Some individuals may live relatively normal lives with medication and lifestyle changes, while others may experience more rapid progression of heart failure. Research into gene therapy and other novel treatments is ongoing, offering hope for future therapies that could target the underlying cause of DRC. Scientists are also working to better understand the relationship between specific desmin mutations and disease severity, which could lead to more personalized treatment approaches.